Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Michelle Spurlock, System Chief Nursing Officer at Acadia Health and a return guest on our show. And today we're going to talk about how her team is using data and analytics to build safer environments for patients and staff through Acadia's new Zero Harm initiative. Great having you back here today, Michelle.
Thanks, Justine. Happy to be here.
Let's get started with just a little bit of a kind of refresher for the audience of your background in nursing and behavioral health and what led you to focus on workforce innovation at Acadia.
Sure. Well, I am one of those rare individuals that my entire nursing career I've been in behavioral health. So that's a lot of years now, so I won't even say how many at this point. But behavioral health has always been a passion. And when you look at the behavioral health workforce, not many nurses go right into behavioral health to begin with. I think like 3 to 4%. So it's always been an area of my focus to look at how do I grow the workforce, and then looking at the innovations. Sometimes we have to get really creative. So in my role at Acadia as a Chief Nursing Officer we have over 250 locations. You can imagine staffing is quite a challenge. So I'm always up for a good challenge and seeing ways we can improve it.
Tell me a little bit about what those challenges look like.
Well, as I mentioned, very few go into the workforce, and research has shown that those going into behavioral health, the nurses, some of them are leaving within the first year, about 35%. And so often that's related to lack of mentorship. They don't have experienced nursing leaders to help them learn the ropes. So trying to find ways to retain our staff has just been really important.
So these challenges kind of inspired Acadia's Zero Harm initiative. Walk us through what Zero Harm is and how it works.
So for us, Mission Zero is Acadia's brand on the Joint Commission's Zero Harm initiative, which is really looking at how do you reduce injuries, falls, med errors across the country. So we branded ours as Mission Zero, looking at every life, every act, no harm to zero harm. And so for part of that, it's looking at staffing. So in my career, I've seen that if the staffing isn't right, I probably said this last year, it impacts everything. So I've just seen that so often. So it continues to be a focus of mine. And part of the initiative we have is to find a way for us as an organization to have a window into the staffing practices across the organization, because I can't staff 100 and some odd hospitals. But if I can look at the data and I can see the practices at the facility, I may be able to help them manage more efficiently, manage more effectively, and then hopefully reduce turnover.
So you're using scheduling data in a really innovative way, not just for staffing, but for safety, satisfaction, and performance. How does access to this data change the way that leaders are making decisions day to day?
So let me give you an example. So with our current partner with Inovalon and our workforce management tool that we're using, I can look at a facility and see how many nurses, how many techs that they have on. I can see the census because we've been able to have the data feed for our census. We've built in our staffing grids. And so with what we're looking at for our Mission Zero initiative is looking at creation of a productivity score. So that may sound simple, but what it's done is it has created a bridge between our finance department and our clinical department, because the finance team, they're always looking at your FTEs, right? They have to look at that operational metric, and they don't understand sometimes why the nursing staff has maybe more than they expected. So the fact that we've been able to agree upon certain staffing ratios or staffing patterns for a census point, and with both of those data pieces pulling into our staffing system, I now have a productivity score that the CFOs agree upon, nursing agrees upon, so then we can look at where we're effective. And what it's helped us do is manage more effectively. We are able to flex our staffing and reduce some of the headbutting, or I guess the disagreements that occurred because of the when we didn't have that productivity score, people were just used to their own metrics.
So let's talk about impact. How has the Zero Harm initiative improved outcomes for both patients and staff?
It's a little too soon for us to have hard data. Again, this is an initiative across all of our facilities. So what I didn't explain earlier is the fact that some of this is grassroots initiatives. So each hospital has taken upon themselves to identify what does zero harm mean to them and what's their mission zero. So the staffing piece and productivity is an overarching corporate initiative, but each facility is also taking that and running with it. So some have done other campaigns on falls reduction. Again, how do they reduce their call-outs for their staff by having really strong presence from the leadership. So, it's always my belief that when you focus on something, it's going to have positive outcomes. So it's really increasing our morale. It's given people something to focus on and really to, partner with other departments with. So we're just excited about where this is going to go for the future.
Absolutely. Behavioral health is one of the fastest growing areas of healthcare. Tell me a little bit about how technology like this is helping address that increasing demand for qualified staff while still maintaining the high standards of care that are necessary.
I wish technology could create staff. Unfortunately, that's not going to happen. And like I said earlier, such a few percentage of nurses and staff go into behavioral health. But I think that if we can staff more efficiently, more effectively, that's going to provide better care to the patients. And what I mean by that is, you would think staffing, for example, would be an easy thing. Just, let me call someone up, have them work a shift. But we have to look so much more at the skill mix. And that's my latest partnership with our folks that I've been working with Inovalon is how can I look at the skill sets of the staff working within the system? So for example, if I've gone into hospitals and I've looked at the nursing staff and they have, let's say, all of their new staff on one unit. Well, that's really stressful because they don't have the experience to help to mentor each other along. But if I'm able to look at the schedule and see, I've got this person who's really experienced on another unit and I can move people around and have better balance, then I believe that that's going to help us with retention because, again, going back to why do people leave? They don't feel comfortable, they don't feel competent, they don't have their mentors. So I do find that the technology and just being able to represent some of this information in pictures, like I said, the data, to pull the seniority, look at someone's experience level and have that show within a schedule, that's pretty innovative. And that will make a dramatic difference in how I believe that my nursing leaders will staff in the future.
And Michelle, we talked probably around this time last year, and there have already been so many advancements just in the last year, but looking forward from here, what excites you the most about the future of further workforce innovation in behavioral health, and where do you see data continuing to really shape that evolution?
I just went to a session at the Empower conference, and it was talking about asking that question, what if? So my brain was already answering, what if we were able to pull information about the patient acuity that would flow into our schedule so that it would let us know when we needed to adjust our staffing. We're currently not doing that. I am not an early adopter of some of the AI pieces. I mean, even thinking about Copilot, I've just in the last couple of weeks figured out, wow, that can be really helpful. So I'm excited to see where some of that technology will just simplify the processes. The nursing leaders have so much on their plates right now. If they can, enter a few questions or have the system do an analysis of, on Wednesdays or Fridays or Saturdays, you have a high level of call-offs. You may want to have a few people extra, willing to work so that you don't have to scramble at the end of the shift to find coverage. If we're able to do some of that information, that's going to really be a game changer for the nursing leaders. It'll make it easier for them.
Well, and I think that's a huge part of why so much of this technology is being developed is how do we make their lives easier so that people can focus more on, what they went into healthcare to do, which is to help patients. So, Michelle, another great conversation. Thank you so much for being here today and, of course, for the continued partnership with Inovalon.
Wonderful. Thanks, Justine.
And thank you to our audience for watching today. Be sure to keep an eye out for our next episode of INOvators.